Let's hop right over to the phones. It's been, a couple of weeks now, hasn't it?
Yeah.
Yeah, we had a couple of weeks off from spending some time with our good friend Dr. Dennis Norem from Mercy Health talking COVID-19, as Dr. Norem has been kind enough to be with us since the very onset of the pandemic. And, well, we're not done yet, and he's kind enough to be with us again this morning. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going this morning?
Well, so far, so good. A little gray out there, but I guess we can't complain.
No, you can. Who's going to listen?
That's right.
We could be living on the coast, either East Coast, West Coast, and getting ourselves cooked.
Yeah, I'm glad to be avoiding all of that. Hey, some hot topics going on with COVID-19 this morning. Couple of them. Pfizer says they're going to meet with top U.S. health officials today to discuss Pfizer's request for federal authorization of a third dose of their COVID-19 vaccine. Company said it was scheduled to have a meeting with the FDA and other officials days after Pfizer asserted booster shots are going to be needed within 12 months.
Yeah, a little controversy about that. That may be true. I think the issue is the studies haven't been completed. There isn't enough information yet. So Pfizer, being the good marketing company they are, they're out there, in the public wanting us to know that we're going to need that booster shot at 12 months. But I think the science hasn't been completed. Maybe true, but we're just not quite there yet.
Rather cynical of you, doctor, right there.
Or
I've been around a while.
I know you have. Or calling it like he sees it. Pfizer's Dr. Michael Dolson told the AP last week that early data from the company's booster study suggests people's antibody levels jump 5 to 10-fold after a third dose compared to their second dose months earlier. They say that's evidence it believes supports the need for a booster.
Yes, and again, that may be true after they complete a few more studies. It's certainly possible. I see Israel suggesting a booster shot for immune-compromised patients because they don't get as good a response at the beginning or with the initial shot anyway, which kind of makes sense. So it isn't clear that everybody's going to need a booster. It may be certain population groups who didn't get as good a response to the initial vaccination may be the ones that have to get it. But again, we just don't quite have the data yet.
Yeah, so if I'm reading in between the lines of your responses there, booster shots was kind of maybe always something we thought we might have to do or maybe probably should do, and anything coming out right now doesn't cement that opinion one way or the other.
Absolutely.
Okay.
They just need more data. The other thing that was interesting, there was some data that suggested people who had COVID, who received the vaccine, their immunity may last several years. So I'll be interested to see what the studies show regarding that. So again, it's probably not going to be booster shots in a year for everybody. It's probably going to be based on some demographic and other factors regarding the individual patient.
You just mentioned that those that got COVID and got the vaccine, is that still something that we're recommending doing, or what is the data on that? Have a lot of people who've gotten the vaccine too?
Yeah, absolutely. We still recommend that people get the vaccine even if they've had COVID. And I think it's even more important now because obviously the Delta variant is the hot topic right now.
Mm-hmm.
Yeah, fill us in a little bit because we keep hearing about the variances, but most particularly we've been hearing about the Delta variants.
Well, before I talk about it, I'd like to suggest to our listening audience to read an article that was in the Sunday Tribune yesterday by Joe Meyer, M-A-H-R. It was a front-page article called COVID-19 Cases Rising Again in Parts of the State. It's an excellent summary of what's going on with our neighbor in Missouri, in the St. Louis area, and what's happening with the rates in southern Illinois with our less vaccinated people. And it illustrates what we knew was going to happen with coronavirus and COVID-19. The Delta variant is much more contagious. There's some estimate that it's 225% faster spreading than the initial COVID-19. So I think everybody's seen in the news that Mercy Hospital in Springfield, Missouri, ran out of ventilators here a week or so ago because of this rapid rise in the new cases there. And they estimate at least 3/4 of those new cases are this Delta variant. Now, in Illinois, we had seen our lowest numbers in months. And I think last Monday, we had no deaths for the first time. Well, that's all going to change very soon because our rates in regions 3, 4, and 5, which are the areas in central, southern Illinois, have dramatically increased in the last week. And this is all certainly due to the Delta variant.
And those on ventilators, those getting hit hard with the Delta variant, are we seeing a vaccinated versus unvaccinated split with that? Is it affecting everybody equally? How are we doing there?
It's 99% unvaccinated.
And that's yes. We've heard that with deaths, obviously, but that's for hospitalizations as well, right?
For hospitalization as well,
okay.
We're probably going to see a few more hospitalizations percent-wise with the vaccinated patients because it is a more contagious and a little more aggressive variant, but death rate is probably not going to go up significantly for the vaccinated people, given the fact that you still have good protection against that serious illness aspect. But the problem is, as you probably know, and it's well summarized in this article, the percent of unvaccinated people in these areas is very low compared to the rest of the state, which means these are going to be the hot spots, and we're going to see a wave of these hot spots coming up in the next 3 to 4 weeks as this Delta variant pushes into Illinois.
And that's something that we can take to the bank. We can count on that. This isn't just a hot spot area that may fade itself out. We're going to see continued progression with it.
I think absolutely. We're going to see, in essence, a mini wave. It's not going to be nearly as bad as what we've seen overall prior to our vaccinations, but definitely in this area, we're going to see a mini wave. And the concern overall is that when you have a large number of unvaccinated patients and you have a variant like the Delta variant, it creates a situation where we could see further mutation and further variants that could be even more aggressive. And I think that's the bigger concern for all of us. And it gets back to the point, the only way out of this mess is to get everybody vaccinated.
You mentioned more variants, and we already have one hitting the news. That'd be the Lambda variant. Where does that rank as opposed to the Delta? We don't know enough yet. Could be worse, or don't worry about it.
Don't know enough yet, I believe, on that one. I think what we're going to see is this wave of the Delta variant, and hold our breath and hope that there isn't some other more aggressive variant coming right behind it.
Dr. Norem, I'd like to get you to weigh in on this piece I'm reading this morning from studyfinds.org, and it talks about a COVID-19 treatment capable of ending the pandemic once and for all might already be available for use. You've got a team of researchers, including 3 U.S. government senior scientists, calling for governments around the world to start treating coronavirus patients with ivermectin. Their findings reveal the drug not only prevents people from contracting COVID, but it also defeats the virus and saves lives. This, according to Dr. Pierre Corey, President, Chief Medical Officer of the Frontline COVID-19 Critical Care Alliance, in a media release. Quote, "We applied the gold standard to qualify our data reviewed before concluding that ivermectin can end this pandemic."
I don't think ivermectin can end the pandemic. There's been a lot of discussion about that over the last several months. And I know we haven't talked much about treatment because the focus has been on vaccination. There's some evidence I've seen in the past that ivermectin may be effective. I just don't know that there's been enough studies on it to show that it's that effective, that it's, that we can use it and it will absolutely treat and cure patients infected with COVID-19. I just don't believe that ivermectin is, the ultimate answer to ending the pandemic.
They say here, researchers conducted a comprehensive review of 27 reports from clinical, in vitro, animal, and real-world studies. Those include 15 randomized controlled trials, which are the preferred scientific method of the World Health Organization, the U.S. Institutes of Health, and the European Medicines Agency. Their findings revealed treating COVID-19 patients with ivermectin resulted in large drops in coronavirus deaths, the recovery time from an infection, and the time it takes to clear COVID from someone's system also saw significant reductions among patients on ivermectin.
Well, it sounds like ivermectin may be effective, but I think the key word there, you're seeing reductions. You're not seeing 100% elimination. Nobody's using that word. So I think the jury's still a little bit out on ivermectin. This popped up maybe 7, 8, 9 months ago. There were several articles about this. And I don't know enough about ivermectin in terms of the studies to say one way or the other, but it's encouraging to hear that this may be an effective treatment, just like a lot of other things that we've come across that we're using. And I think it illustrates the fact that we don't have any standard treatment. We're still trying things to treat COVID-19.
And I'm sure that, being in your profession, you probably have access to the American Journal of Therapeutics. These findings are apparently in the current issue. So I checked my nightstand. I don't have it at home.
I'm out, too.
Yeah, you out, too? You don't have that one?
I lent mine out.
Oh, the American Journal of Therapeutics. The neighbors are always ringing the bell wanting
yes,
that.
They are.
So anyway, that's where their findings are published. Just wanted to get your take on it because we've heard the name ivermectin kicked around a little bit, but this is the first time I've seen anything on it fleshed out.
Yeah, I had not seen anything that comprehensive on ivermectin. In the past, it's just been a few studies, and there was a group of physicians, and I can't remember the name of their group. Again, this was several months ago that was pushing ivermectin. Unfortunately, I guess it's one of those issues where ivermectin has been around forever. It's an antiparasitic drug, and there's not a lot of money in producing and selling ivermectin, so it's not gotten a lot of interest from pharmaceutical companies.
That's a frightening thought right in and of itself, isn't it?
It is. It is. Although with the COVID-19, a lot of things have been tried that are inexpensive type treatments, but it's a comment on our pharmaceutical industry. When you have a generic drug that's been around forever, often there isn't a lot of interest in drug companies sponsoring big studies.
There's no money in it, doctor. I mean, what do you expect him to do?
Maybe what's right. I don't know.
Come
it's just
on.
me. I know.
Come on, speak.
Well, it kind of gets lost in the shuffle sometimes.
It does. It does. Speaking of doing what's right, I think about a month ago I asked you when we were going to be out of the pandemic, and you did the scientifically responsibly right, may I add, weaselly thing of not really giving me an exact date on that. So I'm not going to ask you to update the date or anything, but are we closer to being done with the pandemic today than we were a month ago? Have we just kind of tread water, or have we actually moved backwards?
No, I think we are closer. And again, it's a broken record. The more people we get vaccinated, the closer we are to getting out of this pandemic. And that's really ultimately the only way that we completely get out of this pandemic, assuming that we don't get some god-awful variant of COVID-19 that our vaccines are no longer effective against. And it's back to that point of the sooner we get people vaccinated, the less likely that's going to happen.
Mm-hmm. All right. Well, keep that in mind. Well, as it stands, though, we are not done with the pandemic. So, Dr. Norem, if it would please you, it would certainly please us. We'd love to get together again next week and see what the latest is.
That sounds good, guys. Take care.
We appreciate it. There's Dr. Dennis Norem from Mercy Health.